been reporting this week that measles cases are continuing to rise across Canada. In fact, there are now nearly 3 times as many cases in this country compared to the U.S. CTV's Kamil Karamali is joining us now with more. Good morning to you. So walk us through these latest numbers.
Yeah, Marcia, so we're talking about more than 2,800 cases in the year of 2025 for a population of 40 million people, compared to 1,300 confirmed measles cases in the United States. We know they have a population of 330 million people. So it looks like that we are seeing a much higher case count and obviously a much lower population. So let's break down what we've seen in the week of June 29th. This is the latest week that Health Canada has kept track of measles, and you can see about 120 cases between June 29th to July 5th. Alberta topping the charts with 63 cases. Ontario showing a bit of a downward trend at 14 cases that week. Manitoba 14 cases, and BC seeing an increase of 24 cases. Let's take a look at the year of 2025 so far, and look at that big number on the top of your right, on the right of your screen there, 3,800 plus cases. And you can see in Ontario, that's the largest absolute number with over 2,200 cases. Alberta has the largest number of cases per capita at more than 1,200, and BC and Manitoba over 100 cases each. So quite a concerning trend here, Marcia, continuing, now hitting more than 3 times the number of what the United States is experiencing. Obviously, us having a much smaller population.
And what are we hearing from doctors?
Yeah, doctors very concerned about this, saying that Canada should not be having this many measles cases in 2025, seeing that we had nearly eradicated the disease. And so they are expressing concern. We spoke to infectious disease expert Dr. Isaac Bogosh, who did say that the cases are largely among the unvaccinated, but he also wanted to draw our attention towards that there might be a reporting bias when comparing Canada versus the United States, seeing that Canada's total number of reported cases could actually be closer to the actual number of cases, whereas with the United States measles reported cases, it's actually could be quite lower than what is actually out there, because they're only calculating 40 states, not 50, and many people might not be actually going to the doctor and reporting that they have the measles. Have a listen to what he had to say a little bit earlier.
If you look at the difference in reported cases to actual cases in Canada versus the United States, it's likely that our reported cases are closer to the actual number of cases compared to that of the United States.
And so some slight good news also, Marcia, a bit of a silver lining. He also added that what he likes that he is seeing is that both Alberta and Ontario seeing less of an increase in measles cases week after week. And so we might be heading towards a downward trend, possibly some good news here.
All right, Kamil, thanks for all of that. Now to a